Hi guys, welcome back to my YouTube channel. So today we are going to test urine and using the urine stripes. So I'm just going to explain to you how the testing works, the reading, and as well how I use the stripes before I show you the procedure. So this is how the test reading looks like. You see the different contents that we'll check for in the urine. So aside us wanting to confirm if someone is pregnant in the urine, we can also check for we also need the urine to check for infection. So if you find proteins or you find nitrates in urine, that indicates an infection. So this is how the stripe looks like. And so once you remove your stripe, and then you dip it in the urine, which I will show you just later on in the video how it's done, how the procedure is done. Those are the different findings that we want to, find in the urine. For example, if there are nitrates, that will indicate an infection. So these are the different contents. We have nitrates, urobilinogen, protein, pH, blood specific gravity. So I'll just bring it closer so you can see specific gravity, and then the different colors, and then the different like units, if it's positive or negative. If it's negative, that means it's normal, but then if it changes color, so these are the different contents, and this is how you read it. This is horizontally, and then we read it vertically. So once you dip your stripe in the urine, that's how you go about it. So let's say we are looking for nitrates. So nitrates, we dip it in and probably there's nitrates present in the urine. So keep going, and probably the color is a little bit, that's the last color, that's like a little bit dark pink. So that means we'll take the reading of it. Nitrate, positive. That means we have nitrates in the urine. So that's how you read it. So urobilinogen, you go that way. Then we have proteins, you go that way. Then we have blood, you go that way. So it's kind of a very easy procedure to understand, and everything you'll find it on the container. And then the stripe will indicate you, depending on the changes of the change of the color, it will tell you what content is present. So if that content is present, that means there's an abnormality. So if we have proteins in the urine, we have glucose in the urine, the color will change. But if it doesn't change, that means it's absolutely normal. There's no glucose or no bilirubin present in the urine. So we have the patient's urine. So now we're going to test. This is the urine dipstick. Take it out. You close it. And then we dip it in everything. There we go. You shake it a little bit, and then we wait for like 60 seconds before we can check the findings. Alright, so now we can look at what we found in here. So nitrate is negative. Urobilinogen, okay, that is 16. And then protein, 0.3 plus, pH 6.5,
Blood, there's no blood in the urine, so that's negative. Specific gravity 1.020. Ketone is negative. Bilirubin is negative. Glucose is negative. So that's how you do the urine dipstick.